And today we'll be exploring the topic of COVID-19 and also confinement. But of course, we'll be opening the session towards the end for a Q&A as well. So feel free to gather your questions in the chat box. So whenever you have any questions throughout the session, you can just type it in the chat box. And then after that, during Q&A, we will attend to all your questions. All right. So without further ado, let us start. So just a little bit about our host today, which is Phoenix Signature Kitchen. So Phoenix Signature Kitchen is a leading nutrition food specialist catering to a wide age range of consumers who require extra care during pregnancy, postpartum, post-surgery, healing journey, or simply to prioritize healthy eating habits. Phoenix Signature Kitchen is also voted the #1 confinement food delivery service in KL and Selangor. Now, before I move on, just want to share a little bit about my personal experience with Phoenix Signature Kitchen. So for my second child, Lucas, whom I gave birth to 2 years ago, I met Man Fong, who is the owner of Phoenix Signature Kitchen, and she was very kind to share her confinement food with me, even while I was still pregnant. So for me, I had gestational diabetes. So towards the end of my pregnancy, I had to really take care of my food intake because I had a lot of sweet cravings throughout my pregnancy. And because of that, my sugar was spiked. And sometimes when I'm eating out or when I grab food, it will cause my sugar level to spike as well. So with Phoenix Signature Kitchen's food, it really helped to stabilize my sugar levels, and it really prepared my body very well for my confinement after that, and for my labor and for the recovery as well. So even during my confinement, I had a confinement lady, but after my post-confinement, I was still taking all the healthy, nutritious food from Phoenix Signature Kitchen. So personally, for me, I am very grateful as a customer, as a user, as a patron, to be here, because I know how amazing Man Fong is and her team, and the food that they serve and they provide are really of top quality. So I know a lot of you here, you probably are Phoenix Signature Kitchen customers as well, or you are considering their service. So as a first-hand experience, this is my review. And my sister also just gave birth a few months ago, and she also had her food from Phoenix Signature Kitchen, and she also had a lot of good reviews about their food and service. So definitely very proud to be a part of this the webinar that is hosted by Phoenix Signature Kitchen. And of course, brought to you by Sunway TCM Center as well. Today, we are going to be hearing from two of the experts from TCM Center in Sunway. And a little bit about Sunway TCM Center. It is a holistic approach to healing, and it incorporates traditional and complementary medicine into Western healthcare. Also managed by certified medical doctor and trained in integrated medicine from China. And it consists of a team of trained and registered TCM physicians skilled in their own areas of specialty. And if you're interested to find out more, you can also get in touch with them through WhatsApp, email, website, or social media as well. Now, firstly, we have our first speaker, who is Miss Yu Ki Yi. She is a TCM physician and has a special interest in TCM rehabilitation and TCM fertility, and also has a bachelor's degree of Chinese medicine. And currently, she's a TCM physician focusing on stroke rehabilitation, fertility, weight management, and post-COVID recovery. And she also does consultations and TCM procedures for various diseases apart from these as well. And she also published articles and presentations in medical conferences, and has also been interviewed by local social media such as Sinchu Daily, Public Mutual Magazine, and so on. So today we are very honored to hear from Ms. Hu, who will be talking to us about general facts on COVID-19 and how we can all cope and prevent ourselves from getting COVID-19 as well. So without further ado, let us welcome Ms. Hu.
Hello. Okay. Good evening, everyone. I'm Miss Hu, a TCM physician from Sunway TCM Center. So tonight I'm going to share some general facts about COVID-19 and how it affects our lungs. So, okay, let me share my screen. Okay. Okay, so firstly, let's discuss what you need to know about COVID-19. So as the COVID disease pandemic is spreading rapidly around the globe, and I believe that everyone is very familiar on it. So let us just spend some time to recall. Okay, so just to remind you that COVID-19 is spread in three main ways. So the first one is breathing in air when close to an infected person who is exhaling small droplets and particles that contain the virus. Okay, and then having these small droplets and particles that contain virus land on an object, and especially through the splashes and sprays like a cough or sneeze. So the last one will be the touching eyes and nose and mouth with our hands that have virus on them. So bear in mind that anyone infected with COVID can spread it even they do not have the symptoms. So people with COVID-19 have a wide range of symptoms. So anyone can have mild to severe symptoms such as high fever, consistent or intermittent fever, coughing, sore throat, dry mouth, headache. And as the cases continue to rise, more people will be affected by loss of smell and taste as a primary symptoms. Okay. So how to stop the spread of the virus? You need to wash your hands often with soap and water. And also you can use hand sanitizer and practice the routine cleaning of frequently touched surface. For example, your mobile phone, your keys, and avoid avoid crowds, especially the poor ventilation spaces. Avoid contact, stay at least 6 feet away from people, and do not forget to wear a face mask to cover your nose and mouth, and check your vital sign daily, and also get the COVID vaccines as soon as you can when eligible. Okay, so over the past several months, actually in our center, we do have COVID patients from category 1 to category 4 with the given treatments of herbal medicines. We do teleconsultations, which is something like video call. We will get them to take a picture of their tongue and to diagnose their conditions like the color, cutting, and also ask some questions like how is the symptoms, how they cough, how is the phlegm, and also how the symptoms affect their daily routines. And finally, we will prescribe the herbal meds personalized to each individual. Okay, so and we have found that the effectivity of the herbal medicine used to assist the COVID-19 treatments can include effective relief of symptoms and also retarding the development from mild to severe, improvement of cure rates, and also promotions of the rehabilitations, and eventually can ease the burden of the frontliners during the COVID-19 pandemic. Okay, so for the acute COVID-19 usually lasts until 4 weeks from the onset of symptoms. So such as the primary symptoms like coughing, shortness of breath, and difficult breathing. You may have, some of them might have persistent symptoms until after the 4th, until 12 weeks, or even more than 12 weeks until 6 months, which defined as post-COVID. If you have, for example, generally you might have the fatigue and also shortness of breath, or maybe some insomnia, chest pain, blood clots, chronic kidney disease, or even hair loss. So this is a leaflet from WHO, which provides basic exercise and advice for adults who have been severely unwell and admitted to the hospitals with COVID-19. So you can scan the pink color QR code on the right side or screenshot this whole page to download and share to your loved ones. So in this leaflet, you can learn to, like, for example, how to ease your breathlessness, okay, which is one of the common symptoms of COVID-19. And also you can learn to how to exercise after discharge from hospitals, and also how to manage your daily living activities or manage your stress to get a good sleep is a very straightforward and very easy to use guide. Okay, so let's go to, okay. So now we will go to we will go to learn how to improve our lung health. So the first things is to consult a TCM physician, so we can know more about your body health conditions. And it is very important that to go a certified and qualified TCM practitioners. So the treatments such as acupuncture, motivations has been shown that to effective and safe during post-COVID recovery in reducing the phlegm and regain the patient's stamina, relieve the anxiety, strengthen their lung functions, as well as improve their quality of life. So in TCM, we also promote belly breathing. It is a key of wellness to improve the qi and blood flow throughout our body, to improve our lung capacity and promote the relaxations, and also to improve the body abilities to tolerate intense exercise. And beside that, we also promoting 八段锦. 八段锦 is a kind of exercise that can help to improve our blood circulations and reduce our tiredness, and also relax our muscle and balance metabolism to minimize our sleeping problem. So, and we are currently preparing our tutorials of 八段锦 and will be posted to YouTube soon. So do subscribe our YouTube channels and learn the health tips from us. Okay, that's all from my sharing. Okay.
Thank you so much, Miss
Thanks.
Hu, for
No
sharing.
problem.
Okay, my turn to share screen now. So far, if you have any questions, feel free to put it in the chat box, yeah, so that we can attend to them later on, right? Okay, let me introduce our next. Oh, yeah, before that, we actually have a few questions to ask Miss Hu. Yes, so
Sure,
I think we have one question over here.
Mm.
Can a COVID patient fully recover from this disease?
Okay, so for COVID patient, actually there is a wide of symptoms. So have to depends on what is the symptoms, then we will, and also your body condition. So we will know how can we help for, and how can we help on your COVID recovery. So the first one is it is important that to become active again when you are recovering. So, but this is hard when you feel like very tired and you feel breathless or you feel even weak. So just now I have shared that, maybe I can share once again for my slide. Okay, so probably you can scan this QR code, and also you can take a screenshot. This is a very very clear guide that for the rehabilitations for your self-management after the COVID disease. And also if you do not know how which one you need to go for, or you're not sure how is your body conditions, of course you can consult us. You can tele-consult with us, then we will let you know how is your body conditions, then we will guide you what you need to do, and also for the diet therapy.
Okay, thank you so much.
No
We have
problem.
a few more questions here. So what are some of the herbs that we should avoid when it comes to dealing with COVID-19?
So actually we in this period of time, I believe everyone will receive many WhatsApp message or any Facebook information,
Yes, from all the
and not
family
sure
groups.
whether not sure whether is it correct. So
Yes.
the very important things is do not take any medications or any supplements without a doctor or pharmacist approval. So
Okay.
especially for those the Chinese herbal prescription, and because all the Chinese herbal formulas is serve different purpose and only suitable for specific conditions. So this is why we still need to like double. We will still need to talk that consult certified TCM physicians and practice the safe use of the herbal medicines by getting a personalized prescriptions. And do not forget to monitor your symptom and vital signs such as SpO2, the body temperature, and also the pulse rate. So when you seek, and you can seek any immediate medical attention if you have any symptom remaining or worsening.
Yeah, I think a lot of people, they like you said, we receive too many information, too much every day,
Yes, correct.
info overload, and we don't know what is accurate, we don't know what is false news. So if you don't know, always verify with a doctor or a practitioner before you make any decision, before you take anything, because like Ms. Hu said, Chinese medicine and herbs, they are all very personalized formulas. Like for us, we would not know how to prescribe to ourselves, so it's best to always check first before we ingest any herbs. Second question, what are the herbs that we can take to speed up recovery?
Okay, so as just now I mentioned that we do have the COVID patients in a few weeks and few months before. So we will consult our patients through teleconsultation, through video call. So we will arrange the herbal delivery every like 3 or 5 days, so we can keep track on them to make sure they are well throughout the period. And also beside for getting the herbal therapy, we also promoting the Chinese medicine into your diet. So this is what we say dietary therapy. So you may choose like something like 百合 and also 莲子 or 山药, this kind of foods to nourish our lungs and replenish our yin.
Okay. And besides herbs, what are some of the ways, or what are some of the things that we can take to increase our immune system?
So to increase the immune system, you just need to take care of your basic needs. So the first one is to get the quality sleep, to prioritize a good sleep habits, and also eat a balanced diet, eat variety of foods, and also the last one, you can do regular exercise, like just now the belly breathing, and also the 拔断颈 also can.
Yeah, even for pregnant moms, we can do exercise, right?
Yes,
Like
correct.
exercises. Yeah, I think a lot of moms, especially first time moms, we are very afraid because we don't know what we can do, what we cannot do. So like exercises is good, to help us not feel so lethargic and to also keep us active as well. Okay, final question for this round. COVID-19 affects our organs, especially our lungs, right? So what are some of the ways that we can strengthen our lungs? Besides doing really deep breathing exercises, how else can we strengthen our lungs, especially for those who were diagnosed with COVID-19 and are on their way to recovery?
So after COVID, like some of them may not have the same energy they used to. So like just now I mentioned that the leaflet from the WHO actually the guideline is very easy and very straightforward, so you can learn from the guide, and to it will teach you how to manage your activities of daily living.
Okay, thank you so much for sharing.
No
We'll come
problem.
back to you again during the Q&A
Sure,
session.
sure.
I'm sure we have a lot more questions coming up. But for now, I want to introduce our next speaker. So let me just share this slide. Okay. So I don't know why Jam reading. Okay, sorry. Okay. Okay, sorry for the long wait. All right, next speaker, we are honored to have Miss Man Weng Yan, who is also a TCM senior physician focusing on gynecology. And she also has a bachelor's degree of Chinese medicine from Beijing, China as well, and also masters of Chinese medicine. And she also has a student award, excellent self-funded foreign student scholarship in Beijing, international student scholarship. Wow, this is really very, very impressive. And currently she is a TCM senior physician focusing on gynecology, fertility, weight management, and post-COVID recovery. She also does consultations and TCM procedures for various diseases, and also publish articles and presentations in medical conferences as well. And also guest speakers for 8TV Living Delight, City Plus FM, 988 FM, Family Magazine, Astro, BFM, and so on. So without further ado, I would like to invite Ms. Man to share with us more about how COVID-19 affects pregnancies and confinement and how we can deal with it. Ms. Man, are you ready?
Yeah, ready.
All right. Okay, I
Okay.
will stop sharing and let you share your slides. Yeah.
Okay, thank you. Thank you for inviting us to give a
Very
opportunity for
excited.
us to
Yes,
share
very
this
excited
information.
to hear from you.
Okay. Yeah. Okay, let me share my screen over here. Okay. So, okay, this is my slide. So I'm going to share about COVID-19 during pregnancy and confinement. So mostly I will focusing on affected pregnant mothers or confinement mothers. So next, okay. So based on the research data, current data, most of the pregnant mothers, if they are tested positive for COVID-19 during their pregnancy, mostly will be asymptomatic. So even though some they will develop some mild symptoms like high fever or cough, but usually they will they will recover gradually unless they are infected by COVID during their third trimester, because so these are the risk factors associated with the severe COVID-19 in pregnancy. So for example, one mothers who is increasing age or having obesity or having pre-existing medical condition like hypertension or diabetes, like that. So next slide will be, so if pregnant mothers or during your confinement you are tested for COVID, tested positive for COVID, and you are under home quarantine order, so you can, other than checking your vital signs such as your body temperature, your oxygen level, and also your symptoms, these are the warning signs that you may need to check on and seek for medical attention if there's you have symptoms below this, such as like shortness of breath or chest pain, chest tightness, and for prolonged fever more than 2 days, and have like frequent vomiting, diarrhea, or coughing out of blood, or abdominal pain, and or vaginal bleeding. So these are the 4 main concerns that affected mothers have about their own pregnancy, during their own pregnancy, and about their child. So first one is the mother to child transmission through the placenta. So based on the research now, there's insufficient evidence to confirm that the mother can transmit the COVID virus through the placenta. So it doesn't affect the mode of delivery. So if you are, for example, if you are tested positive just before you get labor, So vaginal delivery is not a contraindication. That means you're still able to get vaginal delivery unless you have symptoms like breath, like shortness of breath, or you have severe kind of diseases or symptoms that are not stable for you to do the vaginal delivery. So then the doctor or the obstetric team will decide the C-section delivery mode for you. So the third main concerns for during the pregnancies or after the pregnancies is the mother's body fluid. So after you give birth, so you need to take care of the child yourself if you won't able to get any help. So some mothers, they will afraid that during their breastfeeding or taking care of the child, their own body fluid will have like will be the a way for them to spread the COVID virus to the infant or the babies. So in order to prevent the transfer of this, to lower down the risk of infecting the baby, so you can try to practice the respiratory hygiene. That means wearing a mask when you try to taking care of the baby or you have close contact with the baby, and also practice hand hygiene as well. So to avoid in case you having like cough or sneezing, the body fluid on your hands, so try to use the soap or water to wash your hands, and then try to keep your breast clean up before you breastfeed as well. So the last concern is about breastfeeding. So so if you are tested positive during the confinement period, so some mothers, they were afraid that if breastfeeding directly to the infant, they will get the baby to affected as well. So but based on the guidelines published by our Ministry of Health, breastfeeding is not a contraindication as well. So breastfeeding should be encouraged even though you are tested positive. So just in case you are isolated from your child, from your baby, you're still able to take out the milk from your breast and then store it and then feed it to your child. So you can get a healthy caregiver to use the express. This is the meaning of express breast milk feeding. So that means a healthy caregiver can use the express breast milk to feed your child even though you are isolated from your child. So the next one is, shall I get the COVID-19 vaccine? So the answer definitely is yes. So most of the, based on the vaccination program and guidelines developed by our Ministry of Health, the vaccinations should be administered between 14 to 33 weeks of gestation. So based on the research we have currently, women who have received the COVID-19 vaccines have higher antibody levels than natural COVID-19 infection, and it is detectable in the umbilical cord and breast milk as well. So I know that during this pandemic, definitely especially if you are tested positive during your pregnancy or during your COVID, during a confinement period, you definitely will feel like devastated if you get the news like when you are tested positive. And so please try to focus on what you can do other than keep on worrying and then crying. I know it is you can feel like helpless or lonely, especially when you are isolated from your child during the confinement period, but try to take care of your emotional well-being as well, because you are the only one your child can depend on. So please take good care on how you feel, and you can still cry or release your emotional, but try to be focused as well. So try to take a break from those negative news or social medias, and try to talk with your loved ones or share your worries or with your partners, or get some help try to get some help, especially when you need it. And of course, take enough rest and enjoy the food you have during the confinement period. Try not to be picky. And the next one is try to do some light exercise as well if your condition is okay and you don't have like severe or too bad symptoms. Try to do some light stretching or belly breathing as mentioned by Miss Hu just now, or some 八段锦 kind of exercise like that. So, and also try to plan ahead about your confinement, especially try to discuss with your partners, because most of the couples I see that maybe they will get like confused, or they will feel like overwhelming when they try to like getting labored, or especially during this pandemic. So try to plan ahead and discuss with your partner what you wish to do, what you hope to do, and what is your plan of taking care of the child, and try to plan your resting time as well. Okay, so this is the information I get from the Ministry of Health from their Facebook. So for the details for further information, actually you can get through their Facebook as well, the Facebook of the Ministry of Health. So these are my sharing now. My sharing ends here. So let me stop sharing and pass to Karine.
Thank you so much for your sharing. Okay, now I'm going to ask you a few questions that we have collected as well based on this topic. So the first question that I want to ask is, what should confinement mothers be aware of when tested positive? Okay. So the moment they go for a test, they feel like, okay, I may have symptoms, so I go for a test and then they are tested positive. What should be the first thing that these confinement moms do? Like they're in confinement.
Okay. Okay, so the first thing is update your MySejahtera COVID-19 risk status. Okay, so once you already update your MySejahtera COVID risk status, go to CAC, the COVID Assessment Center, and usually the medical staff will assess your condition. Like for example, if you are in category 1 or 2, which is you are tested positive but you are asymptomatic, or you have just mild symptoms such as just coughing, fever, no shortness of breath that requires oxygen support, they will send you to the quarantine center. So usually maybe around 10 days, they will keep on monitoring when you are in quarantine center, and they will give the necessary treatment based on your condition as well. So once you are recovered, you don't have much symptoms, no fever, and not much coughing, and after 10 days, usually they will discharge you and you can rest at in your house. So if, for example, you are under home quarantine control order, so for example, if after the CAC medical staff assess, you are advised that you can do the home monitoring at your own house, so you still can monitor yourself, as I mentioned in the slide before. Try to take note of your body temperature, your daily body temperature, and then your oxygen level, and then of course try to practice the hand hygiene, breast hygiene, and then especially when you have close contact with your newborn babies. And another thing is some mothers maybe get a bit worried about that after, even though they're discharged from the quarantine center 10 days later, they still worry that they are positive for COVID. So actually you can still try to get those rapid tests, nasal or saliva, try to get the test yourself. If you don't able to buy it or not sure with the result, you can try to teleconsult the registered practitioners or medical staff, and then try ask the medical advice from them.
Thank you so much for sharing. I think it will really be a very stressful time. You know, you just give birth and you're in confinement, trying to breastfeed, trying to recover. And then you
Yes.
find out you're positive, and then you have to go through the whole process. But no choice, for the sake of, you know, those around us, and also for the sake of our baby, we need to go through that. But touch wood, nobody will gonna, okay? But these are just some precautions that we can take, or like some knowledge that we have in case of anything, or in case you have any family or friends around you who go through the same thing. At least you can advise them as well. So second question, if tested positive during confinement period, how can TCM help in terms of like COVID positive and how to recover using TCM?
Okay, for mother who detected for COVID-19, detected positive for COVID-19, actually we might need to focus on their COVID recovery by doing teleconsultation and arrange the herbal delivery every 3 to 5 days. So we can keep track on them to make sure they are well throughout the period and their symptoms is improving, recovering sooner. And the other thing is, once she's fully recovered, don't have any like fatigueness or other sleeping disorders, we can proceed for the confinement herbal nourishment plan according to her body condition. So other than straight away start the confinement herbal nourishment, we will more focusing on their COVID recovery first, because we know that this COVID-19 is quite severe, especially for those who has a pre-existing medical condition. So we do need to take alert and try, if you are not confirmed about your own condition, you don't know how to assess yourself, of course you can arrange for a teleconsult from us lah.
Okay, that's good to know. At least we know that, you know, when we have any questions, we can always pick up our phone and call you and to ask more info before we move on to the next step. Okay, next question. Can mothers continue breastfeeding during TCM treatment for COVID-19?
Okay, so if mostly for our patients who tested positive for COVID, especially when they are breastfeeding, so even though we prescribe the medication, herbal medication for them, we will let them know that their condition, whether it's suitable for breastfeeding or not. Because for the patients that we've seen, mostly the symptoms they have is very mild. So even though they are still using the herbal medication, breastfeeding is still encouraged as well. They still can proceed with it as long as they practice the hand hygiene, breast hygiene, and then try to wear the mask. And then if they worry about having close contact when breastfeeding, so they can try to take the pump out the breast milk and then store it and ask the other family members to help them to feed the baby.
Yes, that will be helpful. I think these days we really have a lot of different methods to nurse our children, you know. Even if we can't direct latch, we can always bottle feed and tube feed, you know, there will always be a solution. So don't have to worry too much about that. So what if it's not the confinement moms, but the infant or the children, you know, that are tested positive during this confinement period? What should we do, especially when they're just newborn, they can't really take like medicine and all that. So how do we help them to recover?
Okay, so based on the current evidence, most of the newborns or children, even though they're tested positive, and most of them are asymptomatic, or their symptoms is very mild, for example, just fever or diarrhea, and it will recover within like 1 to 3 days, unless
that's very good.
Yes, unless the baby, unless the baby has congenital illness, like maybe some birth defect or some pre-existing kind of medical condition that will lead to more severe stage of COVID-19. But based on the current research data, it's very low the percentage. So if your child, your newborn baby is tested positive, keep calm and just monitor as well. So because most of them are asymptomatic and they are doing well as well. So they are doing well. So you just continue with daily activities, try to breastfeed them and then check on their poops or their urine and then change their napkins. Yeah, that's all. So you don't have to feed them any medication or supplements, especially without doctors or pharmacists advice lah, and still monitor their symptoms, their body temperature, and seek for immediate medical attention if the baby's symptoms remain more than 3 days or get worsening.
That's really assuring to know, knowing that infants, when they are born, they have this strong body immunity against COVID. Yeah, even with it, they don't suffer that much. It's very comforting to know. So thanks for sharing. One last question before we move on to the Q&A. Okay. So what are the services offered by Sunway TCN Center for confinement mothers with positive or post COVID recovery period?
Okay, so for confinement mothers who are tested positive, of course, the main service that we can provide is teleconsultation. So actually, we do during this pandemic, we have not only for confinement mothers, we have mostly is every age range of patients. We do provide teleconsultation as well. So from this month, we have more than 150 COVID patients using our teleconsultation platform services as well. So of course, for this kind of patients, we will try to arrange the herbal delivery for maybe 3 days. We will try to prescribe 3 days or 5 days herbal medication, and depends on patient's condition. So some patients that we think it need monitor closely, we will call them every day or every 2 or 3 days. So this is the teleconsultation service that we have in Sunway TCN Center. And the other thing is for post-COVID recovery period kind of patients, we do, other than teleconsultations, also provide the herbal therapy. We also will advise certain patients to come to our center for treatment, for example, acupuncture or moxibustion or manipulation, because some patients, they having more post-COVID symptoms, for example, especially anxiety, depressed, which affecting their sleeping quality. So sometimes just using only herbal therapy, it's a bit like not strong enough for them. Maybe they need more assurance. So after make sure that they are tested negative for COVID, they are allowed to come to our center, and our center is operating under a very strict standard SOP. So we try to make arrangement. So we will advise patients to make appointment in advance before they try to visit us. And of course, after every sessions of the treatment or consultations, we will do the sanitizing regularly. So, and another thing is like for during like confinement mothers, if they have like a certain myth about the confinement or food, or whether they can do this like washing hair or having shower or after tested positive or like that, we're still able to have consult us through WhatsApp or Facebook, or find some information to approach us lah.
That's very good to know, because I know like new moms, we have a lot of questions
Yes.
on the do's and don'ts, especially like after I give
Mm.
birth, what can I eat? What can I do? How many times can I wash my hair in a month? And these questions, sometimes when we Google, we find all sorts of answers, right?
Yes.
And when we ask our mom or mother-in-law, they'll tell us don't wash our hair.
Yeah, for a whole one whole month.
For one whole month, So there are so many different school of thoughts. So definitely it'll be very helpful if we can just pick up the phone and WhatsApp. It's like WhatsApping a friend, like a doctor friend.
Or Facebook
so that is
message us.
very yes. So that is very reassuring to know. Yes, thank you so much, Ms. Man. We will come back to you again like during the Q&A. We're going to open up for Q&A very soon. But for now, I just want to summarize the session a little bit. So the services offered by Sunway TCM is not just limited to confinement moms with a COVID positive or post-COVID recovery, but also to the general public as well. So if let's say you have any doubts or any queries, you can always just WhatsApp or Facebook Messenger Sunway TCM Center, and we'll be there to help you. And also, I know a lot of pregnant moms here, and you're probably wondering, should I go for a confinement center or should I hire a confinement nanny? What should I do, at this point? So there's no right or wrong. It definitely depends on your personal preference and your family preference as well. But if let's say, you were to get a confinement nanny to come to your place, please make sure that your confinement nanny takes a COVID test before coming, at least a few days before, and then make sure that she really follows her SOP when she travels from her place to your place, and that she hasn't been going around public places, just to safeguard yourself, your baby, and also your family. So that is the least that we can do to make sure that everything is safe and well for your family. But of course, if let's say you are wondering, okay, I want to do my own confinement at home, or I have my mom to help, but I want to cater food. So you can always consider our beloved Phoenix Signature Kitchen. Myself as a patron before this, I can vouch for the quality as well. So they definitely have very good quality in terms of food and also service. So you can definitely consider them. All right. So now we're going to open up for Q&A, and I'm going to invite Ms. Hu to join us as well. Okay. So I think there were some questions before this in the chat. So let us just go through. Yes, we have a question here. Mom with COVID diagnosed who delivered baby, when or how long should a mom quarantine herself before getting in touch with a newborn? Is it following the standard guideline by KKM? Like once you are tested negative already, how long should you keep a distance from the newborn? Or can you immediately be in touch again and then start breastfeeding and all that? Maybe Miss Man, you want to take this question?
Okay, sorry. Could you repeat the question again? So sorry.
Oh, yes, can. So
Okay.
for a mom who was diagnosed with COVID, delivered the baby, how long before she can start to get in touch with her newborn again after the quarantine?
Okay. So once you quarantine for 10 days, you can, to be assured, you can do a RT-PCR test or do a rapid test using the test kit, nasal swab or saliva, to check your the status of your COVID status and also your symptoms. So for example, if even though you are tested negative for COVID, but you still have like throat itchiness, some phlegm, some coughing, or feeling like a bit warm or heatiness kind of feeling, you can try to like get teleconsultation from us as well, and of course try to wear the mask, and then try to get some maybe some herbal medication from our TCM practitioners as well, because to be honest, not everyone will have post-COVID-19 condition or symptoms if you get infected by COVID. So it varies. So some patients, maybe they are patients who have like post-COVID symptoms is more commonly seen among patients who are in severe kind of condition, like category 4 or 5, or some are category 3 as well, like having the pneumonia inflammation of the lungs and requires oxygen support. So it's more commonly seen among these categories patients lah. But for patients who are in category 1 and 2, asymptomatic and mild symptoms, some they just recovered quite well. They don't have any post-COVID kind of symptoms, don't have any emotional distress, and but some they still do have post-COVID symptoms, like they feel more fatigue and they are having like sleeping disorders. So try to monitor your symptoms, and as about how many days you can after discharge you can having close contact with your child actually depends on your condition and how you feel about yourself after discharge. So if you feel comfortable and you don't have much symptoms, you still can do the breastfeeding straight away. Or if you still feel uncomfortable with it, use the express breast milk feeding method.
Yes. Thank you so much for your sharing. I think we have another question. Not really a question. Okay, now no more such guidelines for 14 to 33 weeks already can get a vaccine anytime. Is it true for pregnant moms?
From what I get from the JKJAV, the vaccination from the guidelines from our MOH, published from our MOH, actually is still stated as getting ministered between 14 after 14 weeks will be better. Because even though there are no evidence suggesting that after getting COVID-19 vaccination during the first trimester, most of the mothers, they are having concerns about the possibilities of miscarriage. So in order to let them feel more comfortable and the fetus development is stable, so most, according to the guidelines now, the vaccination still should be administered after 14 weeks will be better.
Yeah, just for a peace of mind. Yeah,
Yes.
because even before 14 weeks, a lot of things also doctor asks us to slow down, try not to eat first, just to get through the first trimester, and then after that when things are more stable, and then we continue. Yeah. We also have another question here. Should I stop my confinement food if I am COVID positive during my confinement? Is it necessary to stop the confinement food? If let's say they are COVID positive, they need to go for like the center, right?
Quarantine center.
Quarantine center. Do they still get the food from?
I don't think you're able to send anything to the COVID quarantine center. So I actually, for confinement mothers, if you are really tested positive, the same thing really depends on what kind of symptoms and what condition you are having during the COVID positive status. So if you didn't feel anything, just remain usual diet will do. Maybe try to avoid certain nourishing herbs like tong gui or some wine kind of diet for maybe 1 week, and then to monitor your symptoms. At least 7 to 10 days just to monitor. So during these 10 days quarantine isolation period, you still can eat as usual and then monitor your symptoms, and that's it. So unless you have like severe, like your symptoms is getting worsening or remains more than 3 days, definitely you will need to seek for medical advice and probably need to get some treatment as well.
Okay. All right. Previously, we also gathered some questions from our participants. So I have a list of them here. We will get back to the Q&A after this question here. So the first question I have here is, how can TCM help COVID patients recover sense of smell? Maybe this one I can let Miss Hu answer.
Sure. For sense of smell or sense of our taste. Okay, so this is one of the symptoms that will be might be the primary symptoms of COVID patients. And for this kind, the sense of taste and smell actually is related to our, in TCM perspective, is related to our lung system. And also we can do, from TCM, we can do acupuncture, we can prescribe herbal medicines to boost the lung qi and also relieve from the nasal congestions to help to get back the sense of smell. And especially Malaysia has a humid and hot climate, and with a higher degree of dampness, which we always heard from others that the subhead. Okay, so dampness. Okay, therefore the Chinese medicine with eliminating the dampness effect should be added.
Okay. Now, we also have some questions here. Besides ONG, what TCM can help during pregnancy period? Is it to increase immunity or to help with smoother delivery? Or is it both?
Okay, for during the pregnancy, actually depends on patient symptoms as well. If you don't have any symptoms, like some maybe during the late second and during the third trimester, some mothers, maybe they are having like swollen legs and then definitely having some sleeping problem, and also having like probably some weight issue or blood sugar kind of issue as well. We need to consult them, and then based on their condition, maybe we will try to give some advice like dietary therapy or certain food they can take more or less or to avoid, and also to prescribe certain herbs only for certain period. So doesn't mean that if you are pregnant, you need to take the herbs, the herbs during the whole pregnancy. So as long as you don't have any symptoms, you feel okay, and you still can manage it by maybe just modify some lifestyle and modify your diet, probably you don't even need the herbs as well. So yeah, that's it. So unless you have like really some hypertension problem or having issue like feel more fatigue and hard to concentrate during your pregnancy, concentrate to work, and then you feel more fatigue, loss of appetite, and even though you control strictly of your diet but your sugar level is still very high, then maybe you really need to consult us about what we can do to change your condition, to improve your condition so that you can have a smooth labor.
Okay. Thank you for sharing. Next question, is it okay to get vaccinated whilst I'm still doing my confinement? Halfway. Can, right? No issue, right?
Actually can.
No issue.
Yeah.
This can.
Yeah, actually
Okay.
can. You can get vaccinated during your confinement period, and also if you want, you also can go and get your vaccinations after your confinement period is end. Also can.
Okay. Should a pregnant mom do self-massage?
Self-massage. Actually, if you feel comfortable, like you have like muscle soreness, definitely you have back pain or your swollen legs or feeling uncomfortable, like here pain, that pain, especially when you have like breast engorgement, when you need to pump the milk regularly, definitely you will feel like muscle aches. So if you can do massage regularly to help to promote relaxation and you feel comfortable and fine after the session, actually massage during the confinement period is advisable. But do bear in mind that if you feel pain during the massage session and uncomfortable after it, that for example you feel more dizzy, more fatigue, or having some bruises, maybe you might need to discuss with your therapist, try to lower down the strength and try to avoid certain parts to be more alert during the next session.
All right. How about pregnant moms? Like when you're still pregnant, is it advisable to get massages?
During the pregnancy, actually depends, especially during your second and third trimester. We will try to avoid during doing like hard massage, too hard force kind of massage on your tummy area or on your back. So the massage we advise is more softer, just to try to relax your back muscle and try to avoid the tummy side, because sometimes some mothers, maybe they will feel more sensitive or uncomfortable when you try to massage their legs or their back, because the muscle tension is over there, the weight is there. So for long-term wise, maybe their leg or their ankle, knee joints will definitely feel uncomfortable. So in order to release the tension and try to reduce the discomfort, you can still do a soft massage by asking your maybe therapist or your partner to help it. But try not to do foot bath during the pregnancy.
Foot bath.
Try to avoid it lah.
Is there any reason why we should avoid it?
Because we know that doing foot bath is try to improve your blood circulation, and in TCM point of view, actually it can help to let your blood circulation is more focusing on the lower part of your body. So we will worry that some patients which is having like quite sensitive kind of body constitution, maybe they will feel some crampness on their uterus or having some vaginal discharge. So during the foot bath, so we just try to avoid it. Like if you having like cold feet, maybe you try to massage it or lift up your leg before you go to bed, or try to wear some socks like that. Try to not to soak your leg for maybe that long hours.
Okay. I have a question here. Any particular area or acupoints we should avoid to massage for pregnant lady? The feet?
Yeah, actually some massage, some acupuncture points in the feet area still okay, as long as you didn't like put too much pressure on it.
Like
Just,
really reflexology.
just try not to do that, because the massage we advise during the pregnancy mostly is try to relax them, not to like stimulate anything. So just try to do some soft massage, like stroking their feet, and then their muscles like that, which should be fine. Of course, there are certain acupuncture points that we need to avoid as well. For example, like San Yin Jiao, acupuncture points which is nearby the nearby the ankle, the calf, inner calf area there. So if you just try to stroke your muscles, actually is fine. But if you want to really like do acupressure, definitely you will need to put more force to stimulate or do the massage on certain acupuncture points. So which I don't think many people will try to do that. So just do a soft stroking,
soft, gentle, relaxing massage. Okay. We have another question here. Can the famous lotus pill help in acute COVID?
Lotus pill.
Is it the 莲花?
Okay. Okay. Do Miss Hu want to answer these questions? I think she's really an expert about this topic.
Okay, but anyway, for the as mentioned, the 莲花 actually is an OTC product in China. So but anyway, for COVID, currently for COVID, we do not have any like specific medication that can cure for COVID. Okay, and another way is for even the 莲花or any other herbal prescriptions, we are not recommend to like self-taking. If you would like to try, I mean, if you would like to consume, then you will need to consume under doctor attention, so you will know like when to start and when to stop. And another one is we are not sure the source of the OTC product in Malaysia. So we are unsure whether it is safe or it is a fake medication or pill. Okay.
Yeah.
So and another one is in Chinese medicines, in TCM perspective, actually we do not have one size fit all for any treatments. So that is why we want to do consultation, then we will prescribe the personalized herbal medicine to them. So if let's say you have any medication or any supplement you would like to try, or you want to make sure whether your conditions is suitable, then you can arrange a teleconsult with us. Then we will advise you how is your body condition, then whether this supplement or this medication is suitable for you.
Okay. All right. Thank you so much for sharing.
No problem.
Another question here, is it safe to breastfeed right after vaccine?
Yes, can.
Can, right? It doesn't affect,
Yes.
right? Yeah, like
yes,
you shared
correct.
earlier. Yeah. Okay. One more question. Would acupuncture help reduce water retention issues on legs while pregnant? Also, would TCM be able to tackle bad skin conditions during pregnancy? Thanks.
Okay, for patients like during pregnancy having like some itchiness of the skin or some swollen legs or extremities, actually TCM or like Chinese herbal therapy is quite effective for these conditions, especially when they're during their third trimester. So but for acupuncture depends, huh? Because some patients they are very scared of needles. So sometimes I will more tend to use some Chinese herbs, like order some prescription, maybe a 3 days or 5 days medication, just try to reduce the swollen symptoms and also to reduce the itchiness of the skin as well, because sometimes this kind of minor symptoms do affect their sleeping quality and definitely having some negative impact on their emotional as well. So rather than using only acupuncture, sometimes I will tend to be using Chinese herbal therapy.
Okay. Thank you so much. We have one question here from Jess. I can't really read Chinese, so I may need some help at the chat box.
OK， 在孕中期发现讲话走路会有喘气症状，中医有什么建议 ？OK， from Jess, actually she's asking during the midterm of pregnancy if she feels like when she try to talk or walking, if she feel like more having a shortness of breath, of symptoms of shortness of breath lah. So what TCM can advise on her condition? So other than Chinese herbal therapy, I will also advise you to try to regulate the way you breathe as well, because most of us have, especially during pandemic, long hours of sitting, and you're overwhelming by those information.
News,
Yes, and then you heard this confinement center has positive news, and then some relative are positive, you'll get like more tension.
Yes.
So in order to like relax yourself, and then sometimes you can just try to do the belly breathing as mentioned by Miss Hu previously. So like belly breathing actually, to be honest, I don't think every people know the method of belly breathing. Most of our patients that when I try to advise them do the belly breathing, they are just how to do that, are just breathing as usual. But actually belly breathing is a bit different from the way we breathe now, because when we try to breathe now, actually you doesn't really need to be that mindful. You just breathe as usual, like automatically.
Very brief, very short breath.
Yes,
Yeah.
it's a very shallow and sometimes rapid kind of breathing. So in order to let you feel more comfortable, like getting more oxygen and try to relieve the symptoms other than Chinese herbal therapy, maybe you try to practice this belly breathing method. So for more informations about the how to do the belly breathing, actually you can go to search our TCM post that which posted by our Miss Who straight away. So there are Chinese version and English version lah. So actually this kind of belly breathing is a very good mindful kind of practice for every people, especially during this pandemic lah. So just
Thank you
try
so
to
much.
do whenever you remember it, even just one time, 1 minute rather than none, because every steps counts.
Yeah, I think this also applies for those of us who are not pregnant. Like we also take very shallow breaths,
Yeah.
and then every day work from home so stressed, no night, no day, right? We don't even remember to breathe.
Yeah, it's true.
So it's also a good reminder for all of us.
Mm.
It's getting quite late.
Yeah.
We don't want to drag on any further. But we have some questions here. So maybe I just take one more question from the list that were sent before this. Self-care guidance without confinement lady support at home. So do you ladies have any encouragement or advice for our soon to be moms, our new moms right now who are like in confinement or at home with a newborn? How can they take care of themselves while they also take care of a newborn, and at the same time having to worry about the possibility of being diagnosed with COVID? So how to stay happy and how to stay healthy during this period?
Okay, so the first thing is your diet during the confinement period and how you take care of the baby. So this is the two main things that you need to solve, I guess. So definitely you need help. So please seek for help from your partner or from any other service like Phoenix Signature Kitchen that can try to provide the confinement food during the confinement period that can ease your burden to cook. So definitely there's a very good services. And the other thing is when you take care of your baby, especially the newborn, definitely you won't have adequate sleep.
Oh yeah,
Especially
what
you
is
take care
sleep?
alone.
Oh.
Yeah. Because you need to wake up every 2-3 hours and then change the nap, change the pampers, and then try to pump the breastfeeding or pump up the milk, and then you need to wash the bottles and then burp the baby. So definitely will need more than 2-3 hours. So once you've already done all these procedures, the next round of feeding the baby come again.
Yes, no chance to sleep.
Yes, definitely. So in order to let you get feel more happy or feel more calm, having a peace of mind during the confinement period, please try to discuss and plan ahead with your partner. So for example, maybe during daytimes, if your partner really need to do works, but still definitely he will have like lunch hours, right? Maybe try to get like shift or during lunch hour, you get a 1 hour rest and then let your partner to take care of the baby half an hour or at least make you a tea or let you rest, or he just take a look on the baby. And like for example, maybe for house chores, maybe your partner can try to help with it as well. So do remember, because a family, those house chores definitely is not a job of gender. It's not a gender kind of job. It's everyone's job.
Yes,
especially in
true.
the family. So try to divide some
responsibilities.
yes. Try to be more sensible and then try to talk with your partner, and then especially if you have like emotional distress, try to talk with your partner. If you really your partner can't really understand what you feel, maybe you can try to talk with your friends or your other family members.
Yes.
Please seek for help, especially when you need it. Because it is not a sign of weakness. Definitely it is, especially for first time mothers, definitely you will need more help than you expected.
Yes. That is very, very true. And like, I really agree with what you said. Communication with your partner,
Yeah.
even starting right now, just discussing about how you can split the responsibilities at home, and just to manage some expectations that, you will need help and you will need sleep, and how your partner can help, or your family members can also take turns to come and help you as well. It really makes a big difference. So communication with your partner, and also taking care of yourself, your emotional well-being, your physical well-being, and mental well-being is very important, because a happy mom equals happy baby as well. As long as we take care of ourselves, we will be able to take care of our baby. But if we're not able to even take care of ourselves, then we can't take care of our baby. So this is very, very important. But thank you so much for all the good questions. Literally, we have to stop everyone. If not, we're gonna go on until 12 o'clock. Yeah, but
Okay.
anytime you have any questions at all, you can always drop Miss Man or Miss Hu a WhatsApp or a Facebook message on Sunway TCN Center's page. And also, you can also talk to Man Fong from Phoenix Signature Kitchen as well. She will be more than happy to chat with you as well. So thank you everybody for spending your evening with us, and thank you Miss Man, Miss Hu, for all your precious insights on medicine and also on COVID-19. Thank you everyone for your time.
Thank you.
And we will see you again in our next session. So thank you, and have a
you.
good night, everybody. Take care and
you.
stay safe.
Thank
Stay
you.
safe. It's an honor to share this information. Take care. Bye. Good
Thank
night.
you so much. Take care, everyone. Good night.
Take care. Bye.